And of course, it would still have to be tested on humans, but interesting study there. Well, we're used to hearing about the dangers of spending too much time in the sun, but how about too little? Well, doctors say that too can cause serious health problems, starting with a deficiency in vitamin D. This is what we've been told not to do for years, because too much sun can cause skin cancer. But some doctors are now saying Americans aren't getting enough sun, which means many of us aren't getting enough vitamin D from the sun.
Vitamin D deficiency can put you at risk for heart disease, for diabetes, for high blood pressure, for arthritis.
And the list doesn't stop there, according to Dr. Karima Hirani of the Hirani Wellness Center in Culver City.
And then finally cancers, from prostate cancer, breast cancer, colon cancer.
We've heard very little about vitamin D until now. There's even a new book dedicated to this one vitamin. A blood test can tell you if you're deficient, but
when you get your levels checked, the lab will report a normal range of being between 10 and 55, but that's not correct. Optimum vitamin D levels are between 40 and 60.
If you are deficient, doctors offer a quick at-home way of determining how much sun is too much and how much is just enough.
The way to determine how many minutes that you need to spend out in the sun, what you need to do is just sit out there and see how long it takes for your skin to turn pink, and then you just spend a fourth of that time in the sun. So if it takes an hour for your skin to turn pink, then all you do is 3 times a week spend 15 minutes in the sun, and you just expose your extremities and either your face or an equivalent part like your abdomen or your back. You only need three days of sun exposure and a very small amount of sun exposure per week.
If you're still wondering just how important this one vitamin is,
vitamin D is formed from cholesterol in the skin from exposure to sunlight. And vitamin D goes and is incorporated into almost every tissue, so every cell.
Very important. Well, those at risk for a deficiency include people with brown or darker skin, breastfed babies, and the elderly. Now, besides getting vitamin D from the sun, you can also take a supplement if that's easier. For more information, you can also go to our website, kcal9.com, and just follow the link. So more vitamin D, but important to get the level checked first. Don't just automatically assume you're deficient.
As with a lot of things, moderation is key.
You got it, Sandy.
Thanks, Silva.
Silva.